being coming from this, health background, I did my post graduation in Ops and Gynae, and then later on moved to IAS, and it has given me extreme, perspectives on both sides. I can say that. So I'll just take you. Let's go. Take a walk through this role of evidence in policy making, being on this side of the system, as you call it. So I would like to, give some of the examples, like how this policy is decided, and what I have, come across during my experience as an IS officer over past 13, 14 years as of now. We all understand what is evidence-based policy making. We know that we have to use what we already know. We have saw a lot of programs that are being run. So we have a lot of learnings that come up from those programs. So we should be able to learn from those shortcomings, or maybe I can say there are always certain learnings that we always get from these kind of programs, and then to build more knowledge and to use that for our new policies that we want to bring into place. These are the certain principles that I have come across during search in the literature, and we understand that we have to build and compile rigorous evidence regarding, especially about cost and the benefits. We should monitor the program delivery, use impact evaluation, so that we know that whether we are really getting effective or not. We should use this evidence to improve our programs, scale it up, what is working, and whatever is not working, we should leave it behind, and then redirect our funds away from those ineffective programs. And this policy making, which is evidence-based, should always encourage innovation and test new approaches. So now, what is the problem? So we all understand, we all talk about this evidence-based policy making, you hear it a lot, but is it really, everything? Because what we understand from evidence-based, the framing is very narrow. From a policy maker's perspective, I would say we would have to explore this complexity, the context, the value-laden ways, the various stakeholders are there. They all have their competing interests. So under this ecosystem, how you fit in this evidence-based, policy making. And I really would like to quote Dr. Iqbal Dhaliwal, who's from JPAL. I am sure you must be knowing him. He was an IS officer and now he's working with JPAL. So he says that instinct, inertia, ideology, and ignorance, these are the 4 I's that drives the policy making. So let's see whether it's like, how does it work? So, now when I sit on this seat, and there are many stakeholders who come to us and they present the evidence that this is something you should work upon. So I see it from 2 perspectives, whether it is a hard evidence, which I see, which is factual, number based, more quantitative, and you can make the sense out of it. And there is some soft evidence which is generated from qualitative interviews, maybe reaching out to the audience, and those are the kind of mix things that I come across usually. And I feel that whatever is presented to the policy maker, the most important thing is the credibility. I mean, first of all, I would say that all the people who are in this advocacy business, like, they should ask this question, that if you're coming to a policy maker, why they should trust you? What is your credibility? If something is coming out of your mouth, why should I first of all listen to you, and then I should act upon it? So if you have that credibility, then I will reach to the next stage of now if you are presenting to me something, then I will go into the quality, the accuracy, the objectivity with which you have done your studies, or what you call the rigorous designs, have they been followed? I trust that if you are talking about that you have done this study design, you have done this population, so that trust is built. And very important is relevance. Many of the policies, I see that something which is very good with evidence, there is a kind of gap. There are people who are doing research, there are people who are making policy, but you may be doing research on something which is not relevant to me. As a policy maker, when we talk about this whole political thing, in the democracy, political representatives, they are representing the population, right? So we need to understand that they understand the expectations of the people, what people expect. So we need to, frame our policies around that. So is your research relevant to what I want? And then the practicalities, which I'll give you some of the examples by which I'm sure you should be able to appreciate it better. So these are certain things which I would say that, when you are in this advocacy business, just think about all these things. whether you have that experience and the expertise on which you are working, for how long, what you have done, what is the crux, what you're coming, because there's so much of evidence lying around. The policymaker has to understand that if you're coming to them, you have the experience and expertise in that sector. There are judgments which we should try to remove, those biases and other stuff. Then habits, traditions, values in which our ecosystem is working, are you aligning with that? You know, the pragmatics, contingencies, there are various lobbyists, pressure groups, the evidence which comes from the research and the resources. Do I have enough resources to actually follow what you're telling me to do? So I have limited resources, I have a limited kitty, so I have to prioritize my stuff. So maybe the research has been done rigorously, we have got very good evidence, the credibility is there, it is very accurate, it is relevant, but I may not have enough resources. So there are so many things that come into play when you actually go for a policy making. So this is the chasm. We all understand government is on one side, researchers on the other side, and we have this distance. Now, how can you improve this dialogue? What, why, when of that? So as I told you, a lot of evidence is there in front of us. It is not just coming from the researchers. Even government has a lot of data itself, which we can go through it. As I said in my first slide, to run through it and understand from that perspective that what were the shortcomings. Should I repeat it or not? How do I go about it? Political will, then making those amendments in the legislations if you need to change the policies. So those are the certain things which becomes like certain bottlenecks, I would say. When you talk about the policymaker and the researcher side, so it's more colloquial. On the policymaker side, you are scientific, we want relevance, you are talking about empirical evidence, we want something reasonable time, in something which is in the reasonable time, we want to come out with a policy which is expected from us, but scientific evidence may take very, very long. We need something within the time, like the time frame has to be decided, but theoretically, scientific research may not be relevant and in that time frame. And then clarity. Many of these researches, as we all understand, I've also come from that research background, that we take a lot of assumptions, when we make those models and then qualifications. So understanding that evidence is also very, very important, that how much it will be, actually applicable to the realistic scenarios. So I'll just talk about a few examples from my own experience. So we know that Niti Aayog is there. Government is now working on those lines, that we really want to bring this evidence into play and then make our policies, do the prescriptive analysis, and then be able to make more evidence-based policy making. So given all the context that I was talking about, Niti Aayog has already set up this data monitoring evaluation office. You all are aware of it. Now this digital data governance quality, this framework is coming up, data DGQI quality index, in which they have made it mandatory that every ministry has to go through these kind of things, where data generation has to be granular. You should use technologies, and they will assess you, all the ministries on those parameters. They will rank you on those parameters and tell you whether you are really aligning with evidence-based policy making or not. National Institute for Transforming India, again under Niti Aayog, is working. Even from the current organization where I'm working right now, Ministry of Power, we are also trying to set up all those kind of data strategy units where we can have this sort of data, clean it up, and use it for our policy making. Some examples from my previous tenure, like Better Birth Trial, I would say very scientifically, rigorously done. You all must be aware about Dr. Atul Gawande. He is the principal investigator. The checklist, he's author of that book, The Checklist Manifesto. So this whole checklist was, we ran this pilot in Uttar Pradesh. It was rigorously done. The results were amazing, but this could not get scaled up in UP. So, maybe sometimes the science is there, the evidence is there. The issue is we did not have the enough resource and other stuff to actually get the checklist and everything in place, and that kind of time available so that everything can be done so much in nitty-gritty. Kangaroo mother care, again, this was the initiative with the World Health Organization, running very effectively. It could be scaled up. It was rigorously done. Less resources were required. People were trained immediately, and this whole has become sustainable. Tamil Nadu is one of the first states with the help of JPAL. They have set up an annual innovation fund since 2014 for this particular sort of a thing. And very recent example of COVID-19 management, I would say that is one of the examples where you can see when the science is not there, not enough evidence is there, how this pandemic management has happened. It is all about, the evidence is coming from so many resources and there was not enough rigor was there. So you know how the policy has been changing, as we learned more about COVID-19. So what is the solution? And just my last slide, I was just say that it is definitely somewhere we have to match the pace. The policy making and the scientific community have to match their pace. We really have to refine the nuances of our research findings so it is easy for the policymaker to understand what you're trying to say in a very, very short span of time, since most of us are very, the time is very limited with us. So I would suggest and recommend all of you like an elevator speech, if you can really concise it and put it in a very easy way. More proactive role definitely from our side. We should also seek evidence and ask for where it has happened, what are the best practices, how I can go about it. We should be trained, I agree, that in monitoring and evaluation of the program, so that we understand in a short span of time that what evidence you are presenting to us, is it really relevant, is it really worthwhile to look into, and then act upon it. And always look for the ethical solutions and do not forget the most vulnerable. So my winding up line is that follow the evidence wherever it leads and please question everything. That's how I work. Thank you so much.